welcome everyone. My name is Nick Moody. Thank you for joining this information webinar on the RAMP study, which is a study of amputations throughout sub-Saharan Africa. The idea of this webinar is just to give you some more information. Everybody that's here has expressed an interest or is already a hospital lead or a national lead for this study. So it's to give a bit more information about where we are, what the study is, and what the next steps are. If you have any questions, please you can raise your hand or type it in the chat box or just ask. And hopefully you can all see my screen, which I'm sharing. And if there's any problem, just let me know. So I'll go through the background of the study, how it's designed and the outcomes, what the different roles are and what they mean, and the timeline, and then we'll just briefly talk about REDCap. I'll try and keep it short so that I don't take up too much of your time. I know it's the weekend, so thank you. So the idea of the study is essentially to give us a snapshot of the causes and the complications and the outcomes of lower limb amputation. Now, anecdotally, we think that trauma causes a lot of the amputations, but there's very little research that kind of gives us good evidence for that. And we know that diabetes and vascular disease are increasing. So what we're trying to do is trying to understand what the underlying causes are, as well as the in-hospital outcomes. So what's happening to people after they have an amputation, a major lower limb amputation. The idea of the study is that any hospital in sub-Saharan Africa can join, and that's any hospital that does at least one amputation a month. And all patients who have a major lower limb amputation, so above the ankle, will be included, and they'll be followed up until they leave the hospital or for 30 days, whichever is sooner. And anyone that contributes to this study by being a national lead, a hospital lead, or a collaborator, so collecting data, will be an author on the publication that results from this. And this will be the biggest study of major lower limb amputations in the region. We know that because already at least 75 hospitals have signed up in 20 different countries. And hopefully between now and September, which is when we start collecting data, that will increase. So they've still got some hospitals, some countries that we want to get on board. So as I said, in terms of a research aim, our primary kind of aim is to understand or describe hospital / 30-day mortality after limb amputation. And then our secondary aim is to try and understand what causes the amputations, and to what extent diabetes and peripheral vascular disease contribute to this burden. We're going to collect outcomes during the study, and the outcomes are going to be divided in three roughly. So there's going to be preoperative outcomes, which are essentially demographic data, comorbidities, and the causes of amputation. There will be intraoperative outcomes, which are the details of the amputation. Was it a below knee or an above knee? What kind of anesthesia did the patients have? And then there'll be post-operative outcomes. What were the stump complications? What were the systemic complications? And what was the mortality outcome? Did patients survive after an amputation? In terms of eligibility for patients that could be recruited into the study, we do not have an age restriction. Any age can be included. Some hospitals or regions will have difficulty in gaining ethics approval to include children. In those cases, then that's fine. We won't include children, but others will want to include adults and children, or just children if they work in a pediatric hospital, then that's fine. And as I said, it's any major lower limb amputation above the ankle. That includes a guillotine amputation, which is then revised. We will not include minor amputations or upper limb amputations. So the way that study is designed is that there is a central team, and then for each country, there's a national lead. Some of you already know who the national lead is in the country, and they will be responsible for overall coordination in that country, recruitment of sites from different areas of the country, and helping to gain ethical approval for that country, particularly if ethical approval is on a national scale. Then each hospital will have a hospital lead, and that hospital lead is normally a consultant in that hospital, and they're responsible for administering the team in that hospital. So they will register the team members and also complete a facility survey, which is something that I'll talk about in a minute, but will give us an idea of kind of how amputations and vascular surgery is done in that hospital. So national lead, hospital lead, and then here you can see we will collect data on consecutive major lower limb amputations, on demographics, causes, and outcomes. You'll have a hospital team, which will be registered by the hospital lead with country lead and then a central team. What I should say is that the data from each country will be de-identified, so anonymized, and go back to that country lead and to the hospital leads. So the hospital data will go to the hospital leads and the country data will go to the country lead. And that'll be anonymized, and that will allow people to understand what goes on in their kind of country and in their hospital. I'm just going to mute. I don't know who's making noise. And I should say that we will start, as I said, on the 1st of September. Let me just mute this person. So where are we now and what's going on? So we launched in January of this year. We've been recruiting sites, which is how I've contacted some of you and spoken to some of you over the time. And we've recruited hospitals until now. So that's where we are at the moment. And then the big push now between now and September is to try and gain ethics approval for each country and each hospital. And that's what we kind of want to focus on. Those of you who have registered will start to get logins for REDCap to register your team. So if you've registered as a hospital lead, you will start to get an email with logins for yourself so that you can register your team in the hospital. And then we will start data collection in September with data analysis thereafter. The study aims to run for 6 months at the moment. So we will start in September and run for 6 months. However, if we collect enough data by 3 months, then we can stop early. And that's something that because we're conscious not to want to collect too much data and make it difficult for everybody. So that's where we are at the moment. It just depends on how many amputations are done in each kind of center. I am at the moment establishing, so obviously the way we kind of talk to each other is often through email or through WhatsApp. To make it a little bit easier, I'm establishing some country-specific WhatsApp groups, particularly when there's a few people in the country. I know I've done this already for Uganda and Kenya, and I know that colleagues from Ethiopia are here, and that I'll do that at some point soon as well. Just so it's clear who the country lead is, where the ethics approval process is, and where we are with that. And the important thing I should say about the hospital lead is that the reason that it's really important that you register when I send you the email is because we want your ORCID ID, and we want the ORCID ID of all the team, the collaborators that are going to help collect the data in the hospital, because we need to make sure that they are then authors on the publication through that. That team, the collaborators, can be clinical officers, junior doctors. It can be really anyone that works in the hospital that is allowed to have access to the patient notes. Doesn't just have to be kind of a doctor or a consultant. So I'm going to pause there before I just kind of briefly cover REDCap. And if there's any questions, just raise your hand and let me know now. or you can just speak if you want. Okay, no questions, great. Okay, so what I'm going to do now is share my other screen so that you can see RedCap. So some of you may have already used RedCap, and for you, this will be fairly simple and you don't have to worry too much about it. For others, this is just the online platform that we'll use to collect the data. So what will happen is I'll give you once you register, or you've given me your email, so I'm going to send you an email with your kind of registration so that you can log in. And then once you log in, you go to My Projects and you'll come to this area. So if you're the hospital lead, you'll come to something that says Site Survey. And then here, so this is, you only have to do this once, and this is going to be hopefully the first time you log in. You will do this, and then you won't do this again. You go to Add Edit Records, add a new record, and this will then give you two things here. And these, A is your team registration, and B, the site survey. So the team registration, you just click here, and I'm going to send a PDF with all these instructions on it so it's clear. And then here is where you hopefully will be able to register your team members. So I already have your name and your details for you if you're the hospital lead. So all I need in here for you is your ORCID ID. And if you don't have a registration for ORCID, you can register here. Or if you've forgotten, you can use this link here. And then for each member of the team that are going to be helping collect the data, it would be good to have their names, their email addresses, and their ORCID ID. So they will have to register an ORCID ID. You don't have to do this all straight away. So if, for example, you know yours and you know this person's, but you don't know this person's or this person's, then you can leave it incomplete and save and exit so that you can come back later and do it. But you should only have to do this once. Some people are going to be hospital lead for different hospitals because they work in different hospitals. Just email me and I will make sure that that's organized so that you can register members at different hospitals. So then you save and exit. Okay. And then, so this means it's incomplete. So this is the one that I just was doing there. It's incomplete because it's red. Once it's green, it's complete. So once you've registered your the members of your team, then the next step is just to do the site survey. This is a survey of the hospital to try and understand how vascular surgery and amputations work in the hospital that you are the lead for. So it's some details on the hospital type, the number of beds, the funding, and then the kind of diagnostics and then medical and surgical therapy that are performed at this hospital. It's not very long. It should take probably about less than 5 minutes, I think. And then there's just a question about how vascular surgery works in this country, that the one that you're in. If you have any questions about this when I send it to you, obviously just let me know, and I'll kind of answer those. So that's the two things that you'll have to do when you first log in as a hospital lead. And then for those of you that will be collecting the data, and I know some hospital leads won't be doing this and they'll have team members doing this, you'll have this data collection. And the way you do it here is you go to add edit records, add a new record. And then this is the data that we're going to collect for patients who have amputations. So I've tried to keep it as minimal as possible so that we're not collecting lots of data that we're not going to use. We're just going to collect data that I think will have an impact, a research impact, and will give us good outcomes. So basic demographics, and then preoperative details. So when they were admitted, why they had an amputation, and if they've had a previous amputation, particularly a minor amputation, any comorbidities, and any imaging. And for some, if you click yes, then you'll get some options of what other imaging options there are. Here we talk about the urgency of the amputation. So how quickly did you aim to do the amputation? The ASA and method of anesthesia, and then just the type of amputation. And as I said, we're not including minor amputations. So this is just major amputations. And who performed this amputation? Now, you can, and then after that, we've got post-operative complications. So stump complications, systemic complications, and then outcome at 30 days. So if the patient was discharged, then you'll have to put in what date they were discharged. If they died, then you have to put in what date they died. And if they're still an inpatient at 30 days, then you just put that in. What I should say is that if you recruit a patient and they've done the amputation, but you don't know yet what the outcomes are, then you can leave it incomplete and exit and then come back and finish it later. But the only thing is you'll have to remember which number that patient was. So add edit records. So that was number one. So I know that this patient that I just did a record for is patient number one. So I'll have to, some people write it down. In your own, you can't put it on here because it's you can't put patient data, like identifying data on here. So you'll just have to remember that this is patient one and come back later when they go home on day 7 and edit it like this. So you just go back in and finish what you started. The other thing I want to say is if, for example, a patient has a guillotine amputation, so an emergency through ankle amputation, and then that when you put in the date here, the date of amputation, that's the guillotine amputation. So let's say we did a guillotine today or 3 days ago, and then they came back and did a below knee amputation today, then you will just have to alter the dates a little bit for that. So the original date is the guillotine amputation date. And then you save and exit. For some people, it might be easier to collect this data on paper forms and then upload it later to REDCap. And that's fine. I'll send the hard copy of the data collection form, so you can do that. It's better from a research point of view to put it directly onto REDCap, but we know that that's not always going to be realistic. And then to log out, you just click log out here, and that's it. So that is REDCap. Has anyone got any questions about REDCap? It's quite simple, really. I should say as well, each individual will have their own login for REDCap. So it won't be one hospital login. It'll be the hospital lead, and then the different team members will have their login for REDCap. But you will be able to, so if I put someone's amputation details in, my other team member will be able to come in and put in some more information like the outcomes. So you'll have access to your hospital's data to edit, but not other hospitals and not the rest of the country. If you've got any questions, just put it in the chat or raise your hand. The other important thing to say is we're at the stage now where it would be good to start getting ethical approval. Like Isaac saying it'd be good to collect on paper, which I will do. Isaac saying it'll be good to collect on paper for data collection. Yeah, I'll send you the stuff. Of course, yeah. Yep, I can. Junior, okay. So that is kind of the overall view of the ramp study. If you've got any more questions, just say. I'm going to go through the presentation again and through the red cap thing again, just for everybody that came late and missed the start particularly. So feel free, if you don't have any other questions, just to head off, and I will follow up with some emails with your logins and a welcome pack for hospital leads. The next step though, yeah, as I said, is ethical approval, which is for some countries is going really well, and for some countries we need to start going, hopefully. And we are still recruiting more and more sites. Be really good. I would love to get to 100 hospitals. If we can recruit from 100 hospitals, that would be amazing. And we're currently at 70 or 75. So if you have networks in your country that you think you could still spread it in, that would be great. I know some countries have more than others. How long? So someone's asking, how long is the data collection going to last? So yeah, so we initially the plan is to collect for 6 months. However, if we get enough data by 3 months, basically, if enough hospitals come on board, then we only need to collect for 3 months. Then we don't need to do the whole 6 months, and that's just to make it easier for everybody for data collection. So initially, I'm planning 6 months, but we'll go month by month for the first 3 and then decide.